after I embarked on this robotic surgery, guess what? The number has gone up to 80%.
My knees are getting bad actually. So particularly in the last 1 or 2 years. So it started to inflame. Sometimes on one leg on the left, sometimes on the right. So of course whenever you get very painful, the painkiller was the only solution. So much so that I got this gastric problem because of painkiller.
So when Mr. Chong first saw me in the clinic, he came with both knee pain, quite a bit of pain for some years already. The exact condition, obviously, he has got a background history of gouty arthritis, and also throughout the whole years of his very active lifestyle, he slowly developed osteoarthritis as well.
So actually, friend, he used to post photographs, pictures, and all in the Facebook as well as in our friends chat group. So one day he posted a photograph where he was sitting on just the stepping stone on the pond, and then he was just relaxing there, and I was so impressed actually. So I quickly showed the photograph to my husband. I said, hey, why don't you try this? Because he has been undecided for quite a long time, thinking whether to do or not. And this friend of mine, since his operation, he has been very active, traveling all over Malaysia, showing pictures and all, climbing mountains and doing other things.
So upon discussion, we discussed about what are the options out there. Judging that he has already exhausted most of the options out there, he has had multiple injection into the knees done before. He has had relying sometimes on quite a bit of painkiller. We were thinking, okay, probably it's about time that he should think about having his knee replaced. So that's when I also recommended to Mr. Chong, maybe he can think about whether or not if he wants to be one of the patients who would benefit from this technology. With the help of the robotic surgery and everything, he was up and walking the very next day morning after the surgery. That is well within 24 hours, less than 24 hours, and he has been up and walking, even though with the bilateral total knee replacement being done. I would say he has improved even more today as day 2, and there is a high possibility that he will be sent home tomorrow.